Whether you watch it, play it, build fantasy leagues about it, or just go to the parties for the different foods everyone brought, sports are most likely a part of your life. Most people have something they are passionate about that gives them a competitive drive. Sports may be a lot of fun, but they often come with a little bit of risk. When athletes are injured, ill, or want to keep themselves from becoming one of the two, sports medicine is the answer. From athletic trainers to sports surgeons, there are many occupations involved. Every athlete may not want to have a reason to see one of these professionals, but they are a major blessing to whoever is trying to recover or keep playing his or her sport. Sports medicine involves many different practices dedicated to helping athletes prevent and recover from injuries, and is a fitting career for anyone who is interested in athletics or health science. During sports, accidents are bound to happen. Any injuries during any sport participation, exercise, or physical activity may require attention from professionals trained in sports medicine. Healthcare providers in the different careers of sports medicine are especially trained to prevent injuries and illness in active people and restore function to injured or ill patients of all ages. Different occupations in sports medicine require different levels of education. According to the United States Bureau of Labor Statistics, degree programs for athletic trainers and other occupations typically include science and health-related courses, such as biology, anatomy, physiology, physics, and nutrition. The typical entry level for athletic trainers and other sports medicine occupations is a bachelor's degree, usually followed by a master's degree for higher occupations, and usually involves internships. Almost all states also require license or certifications for athletic trainers and many other professionals involved in sports medicine. Tending to athletes often requires the help of many different sports medicine professionals with specific occupations. According to the American Orthopedic Society for Sports Medicine, different groups of healthcare workers often work together and can be classified into three groups: physicians in sports medicine, allied athlete healthcare, and indirect care of athletes. There are different careers as a physician in sports medicine, such as team physicians, orthopedic surgeons, and primary care physicians. Some careers in allied healthcare include physician assistants, physical therapists, certified athletic trainers, and more. Athletic trainers are one of the most widely known occupations associated with sports medicine. As more people become aware of the effects caused by sports-related injuries, an increase in demand for athletic training is expected. According to the United States Bureau of Labor Statistics, employment for this career is projected to grow 16% from the years 2019 to 2029, which is much faster than other occupations. According to the American Orthopedic Society for Sports Medicine, athletic trainers typically need a bachelor's degree and take part in many internships starting out. Oftentimes, they need a large amount of additional time spent covering sporting events in order to gain experience. Other occupations that work in allied athlete healthcare include nutritionists, sports psychologists, and coaches. There are also careers that have indirect ties to sports medicine, including exercise physiologists, biomechanical engineers, and even epidemiologists. When it comes to job responsibilities, professionals in sports medicine have a lot of them. According to Ann Smallwood, the athletic trainer at Robbinsville High School in North Carolina from 2011 to present, who has prior work experience with Indiana University and multiple other universities, some basic responsibilities for athletic trainers are looking for potential dangers such as weather and lightning, or maintaining the hydration of their athletes. They also have to know if their equipment is up to standards. Athletic trainers have to be prepared for medical emergencies and are also taught how to do different tapes, rehabs, and help athletes in the recovery process of any injuries that occur. Another responsibility of athletic trainers is rehabilitation. Rehabilitation varies from injury to injury and from athlete to athlete. Athletes' availability is also a varying factor for what rehabilitation looks like. Sports medicine professionals deal with a lot of different types of equipment throughout the workday. Physicians in sports medicine also have to provide medical care outside of the clinic and office setting. According to the American College of Sports Medicine, athletic trainers typically have a medical bag containing the right tools, instruments, and different medicinal items needed for injuries or medical necessity. The contents of a medical bag depend on the type of sport, weather conditions, the accessibility of the bag, and the availability of personnel in the area. Documentation for recording incidents and injuries, as well as signed consents, are necessary parts of a medical bag. Medical bags should be maintained, reviewed, and replenished with supplies often. In conclusion, these professionals are crucial for sports programs by keeping athletes from getting injured and helping them return to action. Different occupations are focused on different levels of medical attention for athletes and involve many different types of equipment. But all sports medicine professionals work together for the best interests of athletes. Communication between athletic trainers, parents, and coaches and other healthcare professionals is essential to ensuring the best coverage and medical attention for their athletes. Athletic trainers and other health professionals have many responsibilities that allow them to create safer environments for athletes and prevent any dangerous situations from occurring. Sports medicine offers a variety of careers that are focused on maintaining the health of athletes in all types of sports and provide a great opportunity for those interested in sports and healthcare. Because of athletic trainers and other sports medicine professionals, people get to enjoy seeing people like Michael Jordan and Tom Brady in the different sports that they love and watch them play injury-free. Thank you.